Hello, I'm Dr. Peush Bajpai. I'm a consultant medical oncologist at Manipal Hospitals Dwarka, New Delhi. I have my core interest in breast cancer, prostate cancer, genitourinary malignancies, and hemato-oncological malignancies. Today I would be talking on prostate cancer. So prostate cancer is actually being realized, being common, and we are getting a lot of patients diagnosed with this disease pattern. And one major probable cause is that awareness is spreading, and then people are going for the blood test, which is bringing up more and more cases in the health hospital facility. But then to say that there is no increase in trend would not be correct. There is definitely some increase in trend as well happening because of the urbanization trend which is happening in our country. Moreover, adoption of a Western lifestyle, also increase in trends in smoking, more so in youngsters. So these all are probably attributing to the cause of the rise in all sort of cancers, and also prostate cancer is one part of it. I would say the major obesity linked phenomena, which is called the metabolic syndrome, is somewhere related to prostate cancer also. So metabolic syndrome, when I say that, it's actually a combination of obesity, smoking, hyperlipidemia, and increased waist size. So somewhere poor exercises. So this all is contributing to prostate cancer. So again, the cause, as I mentioned just now, that adoption of lifestyle should be healthy, and that is one basic thing. And in one line, I would like to sum up that if in case we change our lifestyle to adoption of our socio-cultural food habits, what we have as Indians have been having so far, diet rich in fiber and diet rich in fruits, that was our basic diet. If we go back to that, and of course incorporation of exercise, 45 minutes to an hour of an exercise on a daily basis, taking care of our bodies, I think so that would be adopting a healthy lifestyle. Tobacco is a big no, and I think so weight check, blood pressure check, all this would attribute to a dip in the curve of rise in prostate cancer, which is what we are seeing. Yes. So you rightly pointed out that the symptoms of prostate cancers, when they come, the disease is quite a bit of in an advanced stage. So this is for the fact that the disease most commonly is usually in the peripheral zone of the prostate and not the inner zone of the prostate, which actually would have caused patient more symptomatic in the early stages. So I would still recommend that if the patients, if any of the individual men above the age of 50 years are experiencing their urine issues, their urination issues, as in there is a poor stream of urine, as in there is frequency of urination has increased over a past few days, if they find that the urination is painful, or if they find any sort of bleeding in urination, they should definitely consult the doctor, and things can be looked into from there onwards. So rare case of prostate cancer do sometimes there could be rare manifestations, and we have come across sometimes that there is a dip in blood counts, and patients are presenting with not much of other symptoms, and we see that occasionally patients are just anemic, their platelets are on the lower side, their white blood cell counts are on the lower side, and they have on imaging some lower backbone is sclerosed, highly dense, and then eventually we do a bone marrow and we find that there is involvement of cancerous prostate cells in the bone marrow. So that could be one rare scenario, and we have come across that. Sometimes it can present with very high calcium levels, eventually indicating that the bones are involved in prostate cancer. And rarely we have seen patients presenting with neuropathies, or which I can say that various facial nerve palsies or nerve palsies which could manifest in various ways. So it could manifest sometimes, but most common manifestation is it would manifest with urinary symptoms, or it would manifest as a lower back pain in males. So there have been hypotheses saying that man sexually, a very sexual active man, the lesser chances for prostate cancer. There's no definitive association so established till date. So I would say that still adoption of a healthy lifestyle would be something to be looked into. So prostate-specific antigen test is a blood test, and it is usually recommended as a test to diagnose prostate cancer, specifically once the clinical suspicion is there. Earlier, it was being used as a screening test, and still there is a low level of recommendation. But majorly, if in case one is actually suspecting a prostate cancer, prostate-specific antigen is really useful in identifying such patients. There are certain points which one should keep in mind. So if one is planning for a PSA test, it should be not as a screening test. One should not consider this as a pure screening test. As in, we get sometimes advertisement or editorials in newspapers saying that we do free PSA tests, and one should not fall into that. One should consult their physician or doctor before getting this test done, because if in case there is a positive or a negative value, it has a lot of implications. Every time a positive PSA test does not mean that one would have prostate cancer. It could be infection also. Likewise, a negative test does not mean that there is no prostate cancer. There could be a rare chance of prostate cancer still being there. So please do this test only after consulting your physician, and not otherwise, which on a pamphlet which is available in a news daily, and you go for that particular test. You may be in for a surprise.